Hello, everyone. Welcome to Family Connections Adapt Coalition YouTube Watch Party Series. Today, we have the honor of having Daniel Fernandez and Layla Orlando from Proud Gender Center of New Jersey, who is going to be presenting about their organization and the work that they do. Next, I'm going to present our LGBTQ plus team. Next, I would like to introduce our LGBTQ plus team. First, I would like to introduce Joelle Torres, our senior manager. My name is Jenna Atme. I am the program coordinator for our LGBTQ plus initiative.
Hi, everyone. My name is Isairis Ojeda, and I'm the prevention specialist on the LGBTQ committee.
Thank you, Isa. I will now pass it on to Daniel and Layla. Thank you both for being here.
Thank you all so much for having me. My name is Daniel Fernandez. I use he, him pronouns, and I'm the LGBTQ health navigator for the Proud Gender Center here at Robert Wood Johnson University Hospital, here to present to you our LGBTQ 101 presentation. And just a little bit about the Proud Gender Center. We are in partnership with Rutgers Robert Wood Johnson Medical School. So all of our providers do work with the Rutgers Health, and they provide a wide range of specialized services in supporting the LGBTQ plus community. Some of our services include comprehensive primary care, gender affirmation procedures such as top surgery, facial feminization and masculinization surgery, hormone therapy, vocal training. We also work with a gynecologist, urologist, and provide educational trainings, and also offer a wide range of support groups. So many of you may have seen the acronym LGBTQ, GLBT, and even LGBTQ IAP+, and so on and so forth. The problem with this acronym is that it assumes that each letter has to do with sexuality or sexual orientation. But what we're going to do in just one moment is we're going to unpack each one of these letters and define them for you all. So L standing for lesbian, G standing for gay, B bisexual, T transgender, Q queer or questioning, I intersex, A asexual, P pansexual, and there are many other sexualities and gender identities that we'll discuss throughout the presentation. So to start us off, we're going to go over language and basic terminology. So our assigned sex is the sex that someone is labeled at birth. And this is usually just based on the appearance of genitals and genitals only. So when we're born, the doctor takes one look at us and assigns us our sex at birth based off of the genitalia that is present. Our biological sex is more than that. So it's a combination of genitals, chromosomes, and hormones as well. There are also individuals that are born with a variation of male and female characteristics, and these individuals are called intersex. So oftentimes when we're having conversations around biological sex or assigned sex, we're having very binary conversations, meaning oftentimes we only discuss male and female, but roughly 2% of the population does identify as intersex. So we want to make sure that we hold space for that. Our gender identity is a person's deep-seated internal sense of their own gender. So how they see themselves in the world as, right? How you identify in this world, in this space, how you see yourself, whether it be as a man, as a woman, or another gender identity. A cisgender individual is a person whose biological sex and gender identity match or are congruent. And an individual who is transgender, which is also used as an umbrella term, is an individual whose biological sex and gender identity don't match or are incongruent. It's important to note that someone who is transgender may identify as a transgender man or a transgender woman, or as we call non-binary. Non-binary refers to individuals whose gender identity are somewhat more fluid or fall outside of the male and female binary, which is what we spoke about earlier before. And there are many other gender identities that fall under the non-binary umbrella. So growing up, we're often told that only boys and girls exist in terms of genders, right? We're told that the color blue is oftentimes associated with boys and the color pink is oftentimes just associated with girls. But in actuality, gender expression, gender identity, and biology of sex are more than that. There's more fluidity across the scope. Our gender expression is the gendered way that a person presents themselves outwardly. So this can be presented in a number of different ways. How we walk, how we talk, how we wear our hair, what color we paint our nails, how we do our makeup. So there's an array of different ways in which we express ourselves every day in terms of our gender. There's masculinity, femininity, and somewhere in the gray area, being androgynous is also a way that someone may identify. There are also individuals who identify as gender non-conforming, meaning individuals who fall outside of the binary way of how you express yourself, whether it be masculine or feminine. So individuals who are gender non-conforming can express themselves in various different ways. It's not to say that someone who is gender non-conforming identifies as non-binary or transgender, but they may as well. Our sexual orientation is a person's sexual, emotional, physical, and or psychological attraction to other folks who you see yourself in a relationship with. So some of the sexualities that we have here are lesbian, so someone who identifies as a woman and is attracted to women and women only. Gay, which is also used as an umbrella term, so someone who identifies as a man and is attracted to men and men only. Someone who is bisexual can be attracted to two genders. Again, we just learned that there are other genders and gender identities. So someone who is bisexual, bi referring to two genders. Someone who is asexual refers to an individual who is not experiencing any sort of sexual attraction to other folks. They can be in perfectly normal, healthy relationships. They just don't experience that sexual attraction. Someone who is pansexual, an easy way of learning pansexuality is hearts, not parts. So someone who is pansexual can find themselves in a relationship with someone of any gender and can be attracted to someone of any gender. And it's not to say that someone who is pansexual or bisexual is attracted to every single person that walks by. That is a common myth and misconception about the community, but can find themselves in a relationship with someone of any gender. Someone who is queer refers to an individual who may also identify either within the gay community. It's been more of a term that's been reclaimed over the years. Back in the day, it was used more so as a derogatory term, and now it's been reclaimed. It's a term that folks use to empower themselves as well. And it's just important to note that queer has various definitions to it. So it's important when having conversations around the queer community to check in with folks about how they use that term in their everyday life. Questioning is self-explanatory, and heterosexual refers to an individual who identifies as a man or a woman and is attracted to the opposite gender. So we went over terminology and language, unpacked the acronym LGBTQIAP+ a little bit, spoke about assigned sex, gender expression, gender identity, and also reviewed sexual orientation terms. Now we're going to do a fun activity called myth versus fact. So in just one moment, we're going to have a statement up here on the screen, and your job is going to determine whether you think the statement is a myth or a fact. Myth or fact, all transgender people identify as gay. And that is actually a myth. So we learned that there are differences between sexual orientation and gender identity. There may be individuals who are transgender who do identify as gay with their sexuality, but it's not to say that all transgender individuals identify as gay. Myth or fact, non-binary people may use the pronoun they, them, or theirs. And this is a fact. So non-binary individuals can use pronouns such as they, them, and theirs. And there are also a set of other pronouns, which we call neopronouns, which are separate from the most common used ones, such as he, him, she, hers, or they, them. And here's just a list of pronouns that we use essentially in place of a name. Myth or fact, there are only two genders. And that is a myth. So we just learned that there are more than two genders, being man or woman. We discussed what it means to be transgender. We also discussed what it means to be non-binary. Myth or fact, LGBTQ plus people are mentally ill. Myth or fact? And this is a myth. This is a common misconception still associated with the LGBTQ plus community. Are folks in the community experiencing depression and mental health challenges? Of course, like any other community, but it's not to say that just because you're LGBT means you're gonna suffer from depression. That's not the case at all. Usually those conditions are due to the way that folks are treated in society as a result to being ostracized or experiencing different levels of discrimination. Next, myth or fact. Anyone under the age of 18 is developmentally and psychologically too young to know their sexual orientation and or gender identity. Myth or fact? This is actually a myth. So with regards to child development, typically around the age of 2 to 3 years old, kids become aware of how they see themselves in the world as either a boy or a girl. They may not have the language for it yet, but they typically are able to notice physical differences between them. At the age of 4 to 5, many children start developing their gender identity, and they may begin to start expressing their gender strongly. So hearing language such as I'm a princess, you may hear more of that around this age. So again, usually around the age of 2 to 3, kids start gaining a sense of how they see themselves in the world in terms of their gender. Usually from the age of 8 to 12, most will continue to identify with their assigned sex, meaning most individuals will identify as cisgender. As puberty begins, some youth may realize that their gender identity is different from their assigned sex at birth. So this is when children more often than not start coming out with their gender as a result to experiencing puberty and the physical changes that they're experiencing, which isn't aligning with how they see themselves in the world physically. And 17 and up, they start to develop autonomy over their bodies. And we'll go back to myth or fact. All transgender people transition. All transgender people transition. And this is actually a myth. So one of the common ideas around transitioning is that every single transgender person has a transition to share with regards to undergoing medical interventions. But that's not the case. Transitioning looks different for each person. Everyone's journey is unique to their own. Some individuals decide to socially transition, some decide to legally transition or medically transition, or all three. So there are many different ways to go about your transition, but not everyone can transition or needs to or wants to, and not everyone can access the same resources, unfortunately. So transitioning is the time period during which a person begins to live according to their gender identity rather than the gender they were assigned at birth. And it can be broken down into three ways. So social transitioning can refer to coming out to family members, friends, loved ones, using an affirming name different than someone's what you will call dead name or someone's birth name, as well as pronouns. Someone's pronouns over time may change as well. Exploring gender expression, your appearance, the way that you dress, your hair, your physical presentation, and also using bathroom of choice. And these are just some examples of the ways that someone may decide to socially transition. Medical transition can refer to using hormone blockers, undergoing hormone affirmation treatment or hormone therapy, different gender affirming procedures, surgical procedures, and also vocal therapy. Some individuals make the decision to work with a speech pathologist around doing vocal therapy. And lastly, legal transition can refer to changing your name or gender marker. So the process for a name change is you fill out an application through the NJ courts. This can be done online or through a paper copy. You submit a check with your application, and then you get notified of your hearing date. And after your court hearing date, you update all your legal identifications. We've had many recent wins over the past several years, one of them being our Babs-Sipperstein law, which in New Jersey issues updated birth certificates reflecting someone's gender without having to show any sort of medical documentation. So this was a really big win for us. Prior to this law, someone would have to get a letter of support documenting that someone has undergone gender reassignment surgery or gender confirmation surgery or gender affirmation surgery. So that no longer is the case. With regards to policy, only 22 states prohibit discrimination based on sexual orientation and gender identity. And this is to say that we are very, very lucky to live in New Jersey. So one of the few states that does provide protections for the LGBTQ community. We've also had a bathroom bill passed. So New Jersey's law against discrimination prohibits any sort of discrimination based on a person's gender identity or expression. Everyone is allowed to use the facility consistent with their gender identity. The Affordable Care Act states that it is illegal for most healthcare providers and organizations to discriminate against you because you are transgender. Again, it's not to say that insurance companies are not denying folks access to care, but we do have this law in place. This past April last year for 2021, we were able to gain another win as well with the Gender X being passed. Referring to anyone and everyone who may identify as non-binary or an individual of another gender can opt to have the letter X on their gender for their NJ New Jersey driver's license. And as of 2021, schools must teach LGBTQ history. There are over 50% of trans youth who have reported that they are physically harassed in schools. These are recent numbers. 1 out of 4 trans youth report being physically attacked in schools. 2/3 of these students report that the administration did not respond effectively or respectfully. And lastly, LGBTQ folks of color face consistently higher rates of prejudice and discrimination when compared with white LGBTQ people. So these are just some important statistics regarding the community. The reason why we want to highlight this is why we do the work that we do and serve the communities that we're serving today. There are also different microaggressions that individuals who are part of the LGBTQ community may experience, especially in healthcare settings. So microaggressions basically refer to acts of subtle prejudice or hostility that can be committed unintentionally out of ignorance or consciously rooted in negative attitudes or values towards transgender people and overall LGBT plus individuals. So what does this look like on a daily basis? It can be comments that are hurtful, whether they're done out of ill will or good intention. These examples showcase some microaggressions. But you make such a cute girl. A comment such as that, which is well-intentioned, can be extremely harmful. Intentionally misgendering someone, so knowing someone's pronouns and still using the wrong ones and not correcting yourself, can be a microaggression. Making stereotypical assumptions based on a person's appearance, such as assuming someone's sexuality based on how they express themselves. Making comments such as "it's just a phase" can be very invalidating. Expressing cishet biases, such as asking a woman if she has a boyfriend, making that assumption that she is in a heterosexual relationship. Statements such as "that's so gay," "you pass for a real boy," and even something nonverbal, such as only having male and female on school forms or intake forms, can be extremely invalidating for individuals of any community. And comments such as "there's no such thing as being non-binary." So these are just some examples of some harmful microaggressions that individuals may experience here on a daily basis. And it's important that we become aware of these. So we went over terminology, we discussed language, we unpacked a lot, we unlearned a lot, and we also learned new techniques as to how to ask for pronouns and refuted myths and misconceptions pertaining to the LGBTQ community. Now we just want to wrap up with a couple quick tips or best practices for working with the LGBTQ plus community. Have conversations around gender, sexuality, race, and identity. Be visible allies, such as having business cards with your pronouns on them, name badges. Email signatures and signage is extremely important for your workspaces. Again, don't make assumptions. Definitely ask people what pronouns and name they go by. Have empathy for communities that you're not a part of. Continuing education. There are tons of professional development opportunities out there from educators who not only identify within the LGBT plus community, but are also educators who identify within the trans community and able to offer cultural competency trainings to you all. Again, using affirming name and pronouns, actively learning about different communities that we're not a part of, intervening, stepping in when you hear something, say something and speak up. Supporting laws and policies that prohibit discrimination based on gender identity. Providing accessible, available, and affordable services for everyone. Advocating for accessible services in your workspaces, such as gender-neutral bathrooms. Helping to build inclusive communities and bringing folks to the table. Highlighting the accomplishments of LGBTQ plus colleagues, clients that you work with. Organize, join a support group, get involved in a proud business resource group in your workplace, or even start one. share resources, share information, and share education with other individuals. Have diverse and inclusive leadership, and be consistent, persistent, and insistent advocates for individuals. So again, these are just really great ways to showcase that you're an ally for the community and in being visible. So at this time, I just want to thank you all for your time today. Our website is here for the Proud Gender Center, as well as my contact information for myself and my colleague, Layla Orlando, as well. And be more than happy to take any questions that you all may have at this time. Thank you.
Now we are going to get into our question and answer session. We have Daniel Fernandez and Layla Orlando from the Proud Gender Center. Our first question is, how do most of your clients hear about you and the work that you do?
You want to go ahead and answer first?
All right, I'll start us off. Most of our clients hear about us either through joining our support groups, which we run 3 different support groups on a monthly basis. They also hear about our services through our online inquiry, where they can fill out information, and then that information then comes to Layla and I, and we reach out to those clients looking for referrals or wanting to schedule appointments with one of our providers, and a number of other different ways, whether it be through programming or different events that we do through our providers as well. They're really strong advocates for our center as well.
Thank you.
So the next question is, why is the work that you do important to you?
Can y'all hear me okay? Okay, sorry. So the work is really important to us because representation matters, and it's important to show our youth, especially, that someone is looking out for them. I can only speak for myself, but I didn't have any representation growing up. I wasn't able to have access to half of the things that are available now. And if they were available, we weren't made aware of them. So it's really important for us to be out there and show our community that there's someone who cares about them. We have the resources to help in whatever way possible.
And just to piggyback off of Layla, the work that we do is extremely important to us, just as being members of the community as well, and just really knowing firsthand what the needs of our friends are and our patients are, and we're really here to advocate for them because we do get it at the end of the day.
What are some of the disparities that you have noticed in the work that you do?
Do you want to go?
Yeah, I could start us off. There are definitely a lot of healthcare disparities pertaining to communities of color, especially our underinsured, uninsured, and undocumented population. So we're trying to do more work, advocacy work, and really make efforts to be inclusive of all communities that come here to Robert Wood Johnson University Hospital, especially through our center. We really want everyone to be able to access the care that they need, the health care that they need. But we do notice that there is a gap with regards to people who are from another country, are refugees or undocumented, don't have insurance and really need to start either medication or hormone therapy. So I would say those are the key disparities that we've noticed here.
For sure. I just want to piggyback off that as well. Some people who even have insurance have a really difficult time navigating the healthcare system. So it's really important for us to help them just navigate the intricacies of insurance policies and things like that as well.
In your opinion, where can Essex County or the city of Newark improve to best provide for the population that you serve?
That's a really good question. As someone who's worked in Newark prior, I definitely think that the city of Newark could improve their outreach strategies in terms of where they're doing outreach. Most of our communities like to be out late at night, and there's a huge scene in the ballroom world that kind of goes unnoticed by like mainstream society. And these people that partake in these balls are equally as important. And high school systems and things like that. Daniel did touch upon the LGBTQ plus curriculum and just implementing things like that that make it easier for our community to be noticed and seen is really important.
And I definitely agree with Layla, and can't stress enough that people need jobs now more than ever, but especially folks within the community. Oftentimes, we find individuals who have to engage in sex work just to survive or survival work. So we do need opportunities for LGBTQ folks to be able to thrive and not just survive.
And our last question, what is the most rewarding part of the work that you do?
Uh,
We have lots of reasons. We actually had a patient not too long ago had surgery, and it was a phenomenal experience to just be in the room with them. And they were just so appreciative that we were there to help support them on this journey. And we just seeing how happy this person was for receiving gender affirming care was just phenomenal. And just seeing their smile and just their happiness and their joy is just remarkable. So that's rewarding for me, at least.
and I would have to agree with Layla. That's probably the most rewarding part for me when we get to meet the patients face to face, whether it be in the OR, accompanying them to their appointment or their first appointment, where they're starting, hormone therapy or simply getting a checkup. They just get so happy when they see a health navigator there with them, just to advocate for them, and that makes it all the worth it. So that would probably be the most rewarding part for me.
Thank you so much for answering all those questions.
Thank you so much for having us.
Thank you both.
Thank you, Daniel and Layla, for your responses. We now invite you all to post any questions or comments in the chat. We have our presenters here available to answer you. And yeah, just feel free to ask whatever you want to know about.
And to stay connected with us here at Adapt, you can follow us on Facebook, Twitter, Instagram, and YouTube at Essex Adapt. We thank you for listening in. We hope you enjoyed. Thank you again, Daniel and Layla. We really appreciate you being here. And Isa, thank you so much for being a great help.